大家好，我叫王楠楠，在圣巴拿巴医院下属的华人医疗中心工作。那今天我们请到了3位专家：心理学博士徐培珍，眼科医生郑丽玲，还有理疗博士 Dr. Kate Blucy。那3位专家呢，将从各自专业角度和大家一起来聊一聊疫情期间如何保护视力和如何保持良好的身心健康。那每位专家会给大家做大概15分钟的讲座。理疗博士 Dr. Kate Blucy 讲座的时候呢，我会帮助做简短的中文翻译。最后呢，会留几分钟的时间给大家提问，然后回答大家的问题。那讲座开始前有2点要先跟大家说明一下。这个讲座呢，图书馆呢会录讲座部分，就是讲座部分的录音录像会录下来，然后讲座之后呢会放在图书馆的 YouTube 网页上面。所以呢，为了保护大家的隐私，那讲座中呢，请把自己静音，把摄像头关闭。那讲座部分结束之后，大家如果有问题，这时候可以把静音取消，然后可以可以提问，可以发言。但也可以呢，把问题写在留言对话框当中，那我会念出来，然后请3位专家来回答。谢谢大家的合作。现在呢，我们就把时间交给徐培珍博士，请他来给大家讲一讲怎么做好这个心理方面的身心健康。谢谢。
好，谢谢邀请哦，让我有机会跟大家分享。我今天想要主要分享呢，在 COVID 期间，大家都关在屋子里面啦，然后很担心这个疫情的发展，然后有染到这个COVID-19，所以有的人好像最近就很多的人都有这个焦虑的状况，越来越比较严重一点。所以我今天想要跟大家分享2个小妙方，可以帮助让这个焦虑的情绪或者这个开始一直头脑一直转，想很多想法出来，很多负面的想法出来，怎么样让这些想法能够安静下来的方法。OK， 好。第一个让大家了解一下这个脑部的作用哦，当我们的头、我们的眼睛或者我们的耳朵、我们的五官的这个5觉，视觉、听觉、嗅觉，当我们察觉到这个讯息的时候呢，我们会传送到我们的大脑，经过的第一个关卡呢，就是我们的这个邻边系统。邻边系统你可以看到有这个黄色thalamus， 然后红色 amygdala、hippocampus， 这3个东西是主要在这个邻边系统里面运作的这个机制或者这个部位。这个地方专门掌管着我们身体的这个 fight and flight， 就是我们的这个防卫机制的这个功能。那为什么需要有这个功能呢？就是因为我们有这个地方可以帮助我们，如果有什么危险的状况呢，我们就可以马上很快的反应。那我们的焦虑呢也是这样出现的。我们焦虑其实某种程度上是对我们来讲好的，我们开始会紧张会担心的时候，其实是帮助我们帮助我们怎么样解决危险的状况。譬如说我们如果在丛林里面看到有蛇啦，我们的这个防卫机制马上就会启动，就会帮助我们往这个跑走我们才不会碰到危险的事情。可是呢，有的时候我们的脑子没有办法分辨这个事情是不是真的危险还是假的危险。有的时候这个焦虑多的时候，就代表我们可能把事情看得比事实上还更严重，或者更严重。那当我们焦虑多的时候呢，我们看到我们的神经系统有2个很重要的系统，一个是这个交感神经，一个是副交感神经。当我们这个焦虑多的时候呢，这个交感神经就会开始作用啦，心跳会变快啦，呼吸会开始变急促，胃里面的分泌就会变少，还有种种的这个其他的功能就会 不一样，这些功能不一样的时候呢，就是为了要帮助我们抵抗危险的状况。所以这个时候，让我们心跳跳得快的时候，我们是不是跑步就可以跑得快？我们正肾上腺素会多分泌，这个时候我们就可以帮助我们的帮助我们远离危险的时候，远离危险的状况。可是当我们焦虑过多的时候，就好像是这个错误的警报啦，其实状况并没有这么危险所以呢，我们必须要把过度的这个焦虑降低的时候呢，有一个很好的方法。这个方法呢，待会来跟大家说，它不只可以降低我们的压力，还可以降低我们的焦虑，可以帮助我们把这个血压跟心跳都降低下来，然后我们的脑子呢里面的这个注意力也可以比较集中，然后对事情的看法也可以看得比较全面然后呢，如果我们常做这个活动呢，这个 exercise 也可以帮助我们这个基因的表征，可以增加我们的这个抵抗力。这个东西就叫做腹式呼吸，我想很多人都听过。那腹式呼吸跟平常我们讲的深呼吸有什么不同呢？如果你可以，请所有的听众们，现在来做一次深呼吸 ，OK？ 你的深呼吸是这样的吗？看看这样，是你的胸腔变大，然后肚子变小吗？再一次。如果是的话，那就不是真的腹式呼吸。真正的腹式呼吸是我们呼吸的时候呢，我们的胸腔是平的，我们的肚子变大。像是这样子，你可以注意到你的肚子变大。所以你可以看到左边这个图呢，吸气的时候肚子变大，因为这个气到了肺部的下端，然后所以呢会让我们的中间这个肺部跟肚子中间的横膈膜往下，肚子就会往出去。吐气的时候呢，横膈膜往上提，肚子进去，然后气出来。好，那所以我要跟大家来试试看看你有没有办法在吸气的时候把肚子吐出去。好，慢慢的吸，2、3、4、5、6、7，吐气，慢慢的吐。你可以感觉到肚子变大变小的感觉吗？如果可以的话，那就对了。如果你呼吸的时候还是觉得胸腔比较变大的话，就要慢慢的练习。如果你觉得很难的话，可以躺在这个床上练习，会比较容易。好，那我们来做5次，看看你的感觉怎么样。好，慢慢的吸，2、3、4、5、6、7。吐气的时候可以慢慢的吐，看能不能数到11、2、3、4、5、6、7、8、9、10、11。慢慢的吸，2、3、4、5、6、7。吐2、3、4、5、6、7、8、9、10、11。在吸气跟吐气的时候，把你的注意力放在你的鼻子这边，注意到这个气慢慢的进去，气慢慢的出来。如果你的思绪飘到别的地方，想说我等一下还要做什么事情，我等一下还要煮饭啦，还是什么的话，如果你的思绪飘走了，没有关系，你就慢慢的再把你的注意力集中到你的鼻子来，注意到这个气慢慢的进来，慢慢的出去。来，我们再做3次，吸气，2、3、4、5、6、7，吐气，2、3、4、5、6、7、8、9、10、11。慢慢的吸，2、3、4、5、6、7。吐2、3、4、5、6、7、8、9、10、11。吸2、3、4、5、6、7。 吐2、3、4、5、6、7、8、9、10、11。好，你注意哦，我用这个数字7、11 7-11，希望好记。重点就是在吐气的时候要比吸气的时候慢，然后越长越好，越慢越好，越慢就越可以达到这个放松的效果。当我们的身体能够慢慢的呼吸的时候，就可以把这个讯息，我们的身体就送一个讯息到我们脑子这个 amygdala 杏仁核的地方，叫那个地方要这个放松，现在没有什么危险的事情我们就可以放松下来。好，再给大家看另外一个图另外一个面向的图可以看得出来这个腹式呼吸是怎么样子的。好，另外一个小妙方，我想要还有几个方法就是用冥想的方法，imagery exercise，冥想，然后我们的想象力很丰富，有的时候我们想象的时候呢，就可以把我们的情境带到另外一个情境来，可以稍微把这个现实生活里面，觉得很压力很大的状况或者很焦虑的状况，可以给他稍微重新出发一下，重新 reset， 不会让这个压力越来越高涨，可以重归于零这个方法 OK。 所以有几个这个冥想的方法。第一个我们可以想象你觉得在一个很开心的地方然后让你自己沉浸在那个地方，想象那个地方的风景是什么样的空气是怎么样的，味道是怎么样的把自己的五个感官的感觉都激发出来这样就会能够沉浸到那个地方沉浸到在那个地方的感觉也许那个地方是海边或者是深山里，你觉得或者在湖边你看到这个水的样子或者是在你的 backyard， 在你的这个后院，或者是在你自己的一个安静的房间里也可以。另外一个是你可以想象一个疗愈的光，对你来讲是什么样的疗愈的光好，那我可以稍微跟大家解释一下这个方法，就是你可以想象这个光，如果有一个让你放松的光，这个光是什么颜色的？也许是蓝色的、黄色的，或者是橘色的，像阳光的颜色然后这个光碰到你的身上是什么样的温度？是凉的，是温暖的。然后呢，这个光笼罩着你的时候呢，是你的身上是一个什么样的感觉？是一个很滑的感觉，还是一个痒痒的感觉？不管是什么样的感觉，只要是你喜欢的感觉就好。然后还有这个光也可以带味道来，你可以是太阳的味道，或者海边的味道，或者山林的味道，或者不要有味道。有的人不喜欢味道，也可以完全没有味道。OK。然后呢，这个光也可以带来声音。你喜欢这个光是很安静的，当这个光照耀着你的时候，是完完全全安安静静的。有的人，譬如说觉得工作或者家里的事情很忙很忙，好多声音，只想要静静的，所以你可以想象是一个静静的状况也可以。或者有的人喜欢听轻音乐，也可以想象这个光会带来轻音乐。然后呢，这个冥想的这个活动该怎么做呢？你就是想象着这个光慢慢的照着你，然后呢绕着你的身体，环绕着你或者穿过你然后一步一步的从你的头顶到你的脚然后让自己沉浸在这个颜色里面，就可以给自己带来一个很舒服的、很放松的感觉。另外一个这个冥想的活动叫做 Leaves on the Stream， 就是把一些想法，如果当你觉得有好多想法，各式各样的担心一直跑出来，一直跑出来，不知道该怎么停，你就可以想象自己在河边，然后河上有很多树叶，然后你想象你注意到有什么想法我担心我会得 COVID， 把这个想法这只是一个想法想法不一定是事实想法只是一个想法，就把这个想法放到这个树叶上，然后你看着这个树叶，在头脑的想象里看着这个树叶带着你这个想法流走烦的事情就把它放在上面让它流走 这也是一个很好的方法。另外一个方法，当我们觉得很焦虑的时候呢，我们可以用肢体的动作来帮助我们觉得稳定我们的心情，就是叫做蝴蝶拥抱。把你的2手放在你的这个肩上，这样子慢慢的拍打，越慢越好，也不是越慢越好，就是大概像这样的速度，这样的拍打，可以稳定我们的心情，可以试试看。好，最后一个呢，就是要提醒大家，很多想法我们有的时候觉得会不会怎么样，会不会怎么样，会不会怎么样，这些想法我们会一直钻进去。那要注意，这些想法只是想法，它不是事实。我们不用就是把这些想法吓自己。好，希望这些提醒跟这些方法对大家有帮助。
好，谢谢徐博士讲的非常好，Butterfly， 然后蝴蝶飞，我回家以后要多做一做。那现在我们邀请郑丽玲医生，然后给大家讲一下新冠期间的视力保护。我知道新冠期间大家都窝在家里，然后不管是大人还是孩子，很多人用电脑的时间比以前要多很多。我们请郑医生来给大家讲一讲如何来保护我们的视力，谢谢。
OK， 我的中文不是很会，所以如果你可不可以帮我？我用
会的，
然后你再跟我翻译 ，OK？
好，可以，没问题。
谢谢。So I'm Lillian Cheng. I'm an ophthalmologist. I have been practicing in Springfield. I've been practicing in New Jersey since 2007. And so I'm going to talk to you today about, screen fatigue, eye strain. It is basically what everybody has been asking me. I get these questions pretty much 5 times a day as I meet patients. And it's because we're spending so much time now, everything is online. All meetings have become virtual at this point, and so we are spending a lot of time on computers.
OK，我叫郑丽玲，然后是眼科医生。那现在新冠期间呢，由于大家都在家里面，然后就医的过程当中呢，看病人的过程中，好多人都会有这样的抱怨，我眼睛很疼啊，然后我花在电脑上或者说看其他屏幕的时间太多了，然后很疲劳。好
，OK。So everybody's complaining about too much screen time, but what are they complaining specifically to me of? Eye strain, when they come in and just say my eyes are strained, I have to ask them many questions to really understand what they are meaning by their eye strain. There's many different symptoms and it means many different things to different people. They tell me that their eyes feel tired or they're very red, they're watering, they're stinging, they get blurry at the end of the day, they're getting headaches or their just muscles feel tired.
OK，so 那很多人都会抱怨他的这个眼睛很疲劳，那到底是怎样疲劳呢？那疲劳有很多种，像眼睛很累呀，或者眼睛特别红啊，或者经常流眼泪呀，或者眼睛觉得有刺痛感，总是像有东西在眼睛里面一样，或者看东西的时候会变模糊，觉得看不清楚，那有时候就会头痛，那有时候呢，还有就是眯眼睛太多了，然后脸部的肌肉就会经常很紧张，觉得很累。
So one of the biggest culprits of these complaints is dry eyes, and sometimes we don't even recognize when our eyes have become dry. Naturally, our blinking is designed to help to spread the tears over our eyes. Each time we blink, we actually spread a layer of tears, which rehydrates the surface of the eye. But we actually suppress this blinking when we're concentrating on different kinds of activities. And it doesn't actually just mean screens. It could be when we're driving or reading a book or watching television or using the computer. And then this actually is worsened if you have any conditions that reduce your tear production or you have any oil gland dysfunction, which contributes to the tears.
OK，那现在我们来讲一下这个干眼症。那我们都知道，就是如果说一个人注意力特别集中，不管你是看电视啊、开车呀，或者用电脑，那你的眨眼频率就会降低。 那有的时候呢，有的时候还会更加严重。那如果说你的泪液呀，你的泪液分泌不足，或者你的这个脉视线功能受损的话，那么你的这个干眼症症状就会更加加剧。
So one of there's many different symptoms of dry eye. It could mean some achiness, or it actually reflexively starts to tear. If we actually become dry, our brain knows to turn on the tears, and then we actually start to water. In effect, it's trying to fix the problem. It could be stinging, it could be redness, and then blurriness that comes from the surface of the eye. It becomes very blurry because like it's a skin surface, and when it becomes dry, the skin surface can sometimes become a little ashy if your hands are dry. So same thing with the eyes. If the eye surface is dry, it can be very blurry.
OK，那干眼症状，有几大症状，就是眼睛会很疼啊，或者经常流眼泪呀，或者眼睛有刺痛感，然后眼睛很红，或者呢，就是看东西的时候会很模糊。这个模糊呢，是由于你眼睛的表面太干了，然后造成的模糊。就像你这个经常洗手，然后但是你不涂这个护手霜的话，那么你的手也会变得很干燥。
Mhm. So what can we do about it? Part of it is just remembering to rest the eyes or trying to blink. Forcible blinking is a little difficult because it's actually a very natural automatic response. Normally, we blink about 15 times a minute, but when we're concentrating on something, it reduces to approximately 5 to 7 times a minute, and perhaps even less when we really don't want to miss something.
那这个还有就是那怎么样能够让干眼症变得这个好一点呢？就是说我们要眨眼睛，你要知道正常频率，这个人的每分钟眨眼睛的次数是15次，但是如果你特别专注于某一项事情的话，比如说看电脑、打电子游戏，那么你的眨眼频率就会降低到每分钟只有5到7次。
As far as different kinds of artificial tears, there's many different types of over-the-counter tears, and many of them are all-purpose, but some of them serve specific purposes. So oftentimes it's good to visit the eye doctor if you're not sure exactly which formula might be best for you. And based on your examination results, they could tell you, which ones are the best ones that might work best for you.
OK，那改善干眼症的话，有一个办法就是那个人工泪液。那现在像药房里有很多这种非处方的人工泪液。那还有呢，就是最好还是要去看一下眼科医生。那眼科医生会根据检查的结果，然后来向你推荐哪一种人工泪液比较适合你。
Beyond that, sometimes I actually prescribe medications. These are anti-inflammatory eye drops. There's 3 different kinds that are out available on the market that you can get prescribed from a typical pharmacy. Restasis, Xiidra, and Cequa are all available. Insurance coverage can be different for all of them, so typically I choose the one that the insurance company covers best. But what they do is they basically reduce the overall inflammation on the surface of the eye. And generally, when your eyes are dry for a long period of time, it can cause a lot of inflammation. So this can help the surface of the eye become more healthy.
OK，那有时候呢也会开一些处方的抗炎症的眼药水。那下面3种呢，就是经常会开的3种眼药水。那医生开的时候会根据保险公司是否报销这个眼药水，然后来开保险公司会报销的那一款。那这个抗发炎的眼药水，它主要作用呢，就是因为你的干眼症如果太干的话，那时间长了就会容易导致发炎。那它可以改善你的这个能够抗炎症，然后让你的这个干眼症能够逐步的得到改善。
As far as other treatments go, sometimes there's blepharitis. Blepharitis just basically means that the eyelids, they all have these oil glands that line them. And then they become very inflamed. They build up, just the normal dead skin cells, dried mucus and debris, which can clog some of those pores and can cause the surface of the eye to become very irritated. I'll explain one sentence at a time.
OK，那还有就是说是这种眼睑炎，眼睑炎是治疗。那眼睑炎主要是什么呢？就是因为它的这个眼睫毛这里呢，因为它经常会有一些死掉的皮肤呀，然后就会如果而且会有油脂，然后呢，有的人呢就会有很多这种死的这种皮屑，然后就会导致他的眼睑炎发炎。
And why is this important to dry eye is because our tears are not just they're not just a water component. They also have some oil to it. It's like the concept is if you washed your hands too many times and didn't put lotion on, it would become very dry after a while. The oils actually help to stabilize the tears to keep them from evaporating so quickly, and it helps to keep our eyes more moisturized.
OK，它不光是有那个眼泪，不光是有水，它还有那个油质。这样的话呢，就是可以保持你的眼睛，然后不会太干，然后就像你总是洗手，然后不涂护手霜，然后那个皮肤就会很干燥，是一样的道理。
So basically, we want to keep everything clean and clear so that the tears are actually complete, that they have all the different components that help it to stay healthy and to hydrate our eyes. Ways to do that is by using a warm compress once a day. So just simple as a clean small washcloth under hot water. You put it on the eyelids for a few minutes, and that helps to soften things up, and it really helps to kind of loosen things and opens up the oil glands so that they produce more freely.
OK，然后那一个办法呢，就是用热敷，然后就是拿一块毛巾，然后放上热水，然后敷在你的眼皮上面，然后大概过一段时间，这样的话呢，就是可以让你的那个眼睑，然后能够制造更多的这个油脂，然后能够保护眼睛。
Also, they sell these over-the-counter cleansers that are very good at cleaning the eyelashes and eyelids, and it can reduce some of that debris that gets built up.
OK，他们在那个也会卖一些那种在counter 上，就是那个药房里面就可以买到，然后也可以帮你清洗一下你的那个眼睫毛啊、眼皮，然后眼睑，这样的话，然后帮助它保持干净。
And then in more severe cases, your doctor could potentially basically they clean out the oil glands manually, and there's different ways to do that, and there's different doctors that might have different technologies for that.
那严重的话呢，可能就要去那个医生那里，然后他会帮你做一些清理的工作。
Also, a way to help improve the dryness of the eye is that there's what we call puncta, and that's basically sort of an opening into a drain into the eyelids. And we all have them in our upper and lower lids. If we close them, that helps to maintain the moisture that we're producing or the moisture that you're adding back from the artificial tears.
OK，还有一种呢，就是叫泪管栓塞，就是把你的这个眼睛和你的鼻腔这里，然后它可能给你塞住，这样的话呢，就是可以保持你的这个眼泪，然后不会流失，然后呢，可以保持你的眼睛能够比较湿润。
And these are things that are not noticeable to other people, and they are not always permanent. You can actually, there's some dissolvable ones that are helpful. I have some patients who just have them for winter time.
OK，然后呢，他们有的病人只会就是在冬天这样子弄一下，然后这个可以保持眼睛干燥，眼睛湿润，因为。
Focusing issues are also very common because we're spending a lot of time doing near work. When we are focused on near activities, our eyes are naturally using these internal muscles that help us to bend the lights so that we can see things up close. So that can be very tiring if it's constant to those muscles, and they can start to feel very fatigued by the end of the day, and you might have difficulty focusing at the end of the day.
OK，那我们眼睛如果放在屏幕上，然后经常盯着某一个东西看的话，那时间长了眼睛就会疲劳。那一天结束的时候呢，你就会发现你会没有办法这个盯着就不再能够有办法盯着某一个东西看，因为会很累。
So one of the things that ophthalmologists have come up with is something called a 20-20-20 rule, which basically means that every 20 minutes you want to look at something far away, so at least 20 feet away for about 20 seconds or so. And it doesn't have to be exact, but it's really just a reminder to take little breaks every so often, break that focus, let those muscles relax, and that will help to reduce your feeling of fatigue at the end of the day.
OK，那眼科医生经常建议的一个办法呢，就是20-20-20护眼法。就是说呢，你每20分钟的时间休息20秒，然后呢，盯着远方看，大概20英尺6米以外的地方，然后看一会儿，这样的话能够让你的眼睛得到休息。当然不一定是每20分钟，但是要时刻的提醒自己，然后过一段时间要让眼睛休息一下。
In addition, if you are older than maybe in your mid 40s, a lot of people start needing some reading glasses. What's happening is we're actually losing our ability to focus as we age, and that's normal. But sometimes it can be very tiring, especially for patients of that age, to focus on things for too long. And so there are prescription glasses that can be done to focus specifically on your workspace. And this helps to relax those internal eye muscles, and again, can help to reduce the tiredness.
那像有的人一般到40多岁以后呢，然后眼睛就开始慢慢老花了，那么就需要戴上那个reading glasses，就是老花镜。然后呢，医生也可以配那种就是专用的电脑的专用眼镜，然后呢可以让你这个近距离看东西的时候会比较有帮助。
Glare can also be something that can cause more eye strain. Basically, if the environment is too bright or too dim, then it can be difficult to see. And that can also, lead to more fatigue. So if the screen is glowing too bright, brighter than your surroundings, your eyes have to work harder. You want to adjust the brightness to match the surroundings. And that helps to improve the contrast and makes it easier on your eyes.
OK，那如果光线太亮或者太暗的话呢，都会让眼睛特别疲劳。那如果你看到的屏幕，然后相比周围的环境太亮了，然后你的眼睛呢就会要调整自己，然后去适应周围的这个光线。那时间久了，眼睛就会很容易疲劳。
And you're going to hear a lot more about positioning, but basically just having a good position for, adjusting your body and your seat from your workspace about 25 inches away from the screen, and adjusting the screen so that your eyes is slightly downward and not straight ahead or even up, which can also lead to more exposure of the eyes themselves, and then more drying and more discomfort.
还有就是要调节你自己的坐姿，然后一般来讲呢，眼睛要距离屏幕，然后要大约25英尺，大概就是60厘米左右。然后呢，你的眼睛呢应该是稍微向下一点，然后看这个屏幕，而不是说平视或者是仰视。
So some tips for my office workers, these are things that I remind them to do, especially if they're suffering from dry eye, is to keep those artificial tears handy and visible so that you are reminded to use them. If you put them in your pocketbook or in away so that you can't see it, you will definitely forget to use them. So keeping it underneath the screen and just remembering I need to use this when my eyes start to feel a little uncomfortable, it's very helpful. Also having a humidifier is helpful in creating a better environment, and then trying to avoid sitting directly in front of a vent or a fan, which is of course very drying.
这是几个那个帮助长时间坐在办公室里看电脑的一些有用的小贴士吧。第一个就是人工泪液，那你要把你的人工泪液就放在你的电脑旁边呀，或者放在你这个不会忘记的地方，可以提醒你，然后经常要滴一滴。还有呢，就是要使用空气加湿器，然后让空气里面的湿度呢不至于太干燥。 还有一点就是说，要避免坐在正对着让你的眼睛正对着空调的出风口或者风扇的地方，这样的话，这个眼睛很容易就会变得干燥。
As far as these blue light glasses, they're very controversial right now. I don't think they're very harmful in any way. Basically, the idea is that blue light is the type of light that is emanating from our computer screens, and they can potentially affect our circadian rhythms or our natural sleep cycle. And so, the idea is to try to limit, in general, screen use 2 to 3 hours before bedtime because it can trick our mind into thinking that we should still be awake, and it can cause people to have some more difficulty falling asleep late at night. So that's what really the blue light glasses are really designed for. But that being said, I think what's happening now is that people are also using them to reduce the glare on the screen. And that actually does help quite a bit with fatigue. It's not truly necessary. You could just adjust the lighting on the screens, and I think that would help just as much. There's really no evidence to suggest that the blue light actually damages eyes.
那就是说，蓝光眼镜到底对缓解用眼疲劳有没有用呢？现在没有证据说蓝光会对眼睛有危害。那么现在大家用蓝光眼镜，最主要的是因为呢，那个蓝光对人体的这个昼夜节律是会有影响的。那如果长时间的话看电脑，那人呢就是该睡觉的时候呢，还是保持着很兴奋。那戴上蓝光眼镜呢，就会让人这个比较不会受到这个蓝光的影响，可以保持这个有一个比较好的这个生活的节律。那睡前2到3个小时呢，要尽量控制看电子产品的时间，这样的话你可以有一个比较好的休息时间。
As far as contact lens wearers, what I've told patients is if they're using the contacts too long, they will definitely feel a lot more tired. Contacts tend to pull fluid off the surface and can dry the eyes out. So you want to try to limit the contact lens use and only have, wear them just for work, or if you have to wear them in the evening, then have a break day where you just wear glasses during the day. Also, never sleep in the contact lenses, even if they're labeled for extended wear. Follow good contact lens cleaning practices, and then always make sure to keep track of when you open the contact lenses. If they're monthly, 2-week disposable, or a daily disposable, you want to make sure you throw them out when it's appropriate.
那对于佩戴隐形眼镜的人呢，那一定要控制佩戴隐形眼镜的时间。那1个星期呢，你至少有几天的时间呢，只戴普通眼镜，不要戴隐形眼镜。还有呢，就是绝不能戴着隐形眼镜去睡觉。那即便那个说明书上说，这个隐形眼镜是常戴型的，然后你就是晚上睡觉也可以戴，但是呢，眼科医生是不推荐这样的。还有呢，就是要使用优质的隐形眼镜的这些护理产品。还有最后一点呢，就是说要按照它的使用周期，然后定期更换佩戴新的隐形眼镜。比如说有的月抛型，那你1个月就要换新的，然后半月抛就是2个星期要保证你要换新的隐形眼镜，或者日抛型就是每天你都要换新的。
So basically, the question of when you should see your ophthalmologist, I mean, in general, most people do need regular eye exams at least once a year. But if your symptoms are not improved and you are not truly due for a visit, it's important to visit them if you're having any troubles. They can rule out any real medical causes for dry eye, such as allergies or eyelid or eye disease, medication side effects, and autoimmune disorders. It can also check and see if you have any muscle weakness, as far as the external or internal muscles of the eye. And finally, they can come up with a new prescription that helps to optimize your workspace. And what might be nice is to actually have an idea of how far you sit from your computer screen or whatever activity you're trying to do, to let them know exactly where you're having problems, and they can work with you to try to prescribe a pair of glasses that fits right for you. There's really not always a one size fit all kind of a prescription for patients.
一般来讲呢，一般呢都是1年去看1次眼科医生。 那当你就是说眼睛有问题的时候，然后症状没有得到缓解的时候，那你就要去看一下眼科医生。那眼科医生会帮你分析到底是什么原因造成的干眼症，眼睛不舒服，是过敏呀，还是说眼睛眼睑有疾病了，还是说因为药物副作用，或者是因为类风湿疾病造成自体免疫性。还有就是说你的肌肉，眼睛的肌肉是不是无力啊？比如说眼睛内聚力，或者说调节机能不足。再有呢，就是说，那你要跟你的医生谈一下，然后你的这个办公情况是怎样的，那医生会帮你分析一下怎么样去改变，怎么样去得到改善。比如说帮你配一副适合你的专用的眼镜，然后来调节一下，然后使你的眼睛能够眼睛症状能够缓解。
Okay.
OK，谢谢。
Okay.
Yeah, thank you, Dr. Chan. OK，下面呢，我们就来邀请 Dr. Kate Blucy. Thank you, Dr. Chan. Now I'll hand it over to Dr. Kate Blucy.
Okay, can you see it okay?
Yeah.
Okay. Okay, my name is Kate Bellucci, and I will be speaking about physical therapy during COVID-19 and top things that we have seen throughout the pandemic and how to take care of yourself.
大家好，我是 Dr. Kate Blucy， 然后我是理疗师。那今天来给大家讲一讲这个新冠病毒和如何做理疗。
And as I said, I'm a doctor of physical therapy, and I work at the Barnabas Health Ambulatory Care Center. And I specialize in treating patients with neurological conditions, but I also see patients with other orthopedic concerns as well.
我是那个物理治疗博士，然后呢，也有多发性硬化症认证的理疗师。那我在那个圣巴拿巴医院的门诊部工作。我的专长呢是做一些神经理疗方面，但是我也看其他的一些理疗方面的病症。
Okay, so here are the topics we'll discuss today. I'll talk about 2 patients that we've seen at the clinic, top ailments and concerns we've noticed at the PT department, general recommendations to prevent injuries that we discuss, as well as some contact information for us.
那今天我们主要是来讲2个我们在那个门诊部看到的案例，然后呢再给大家讲一讲最近期间理疗部常见的一些病症，同时给大家几点预防受伤的几点建议。
Okay, so here's the first patient that we'll talk about. He is a 59-year-old male with Parkinson's disease, and since the pandemic, he has been working from home at a desk and reports onset of low back pain that occurs toward the end of the workday.
这是第一个案例，是一个59岁的帕金森氏男性患者。从今年3月份开始呢，就一直在家里工作。他在家里是使用那个电脑转椅，然后呢，这段时间呢，经常会工作结束的时候呢，会背痛。
So since he has been sitting quite a bit, we decided to give him a treatment program of standing every 30 minutes during waking hours, changing his sitting position and placement of his work desk as able, as well as raising the height of his laptop so that he wasn't straining his back and neck. And now the patient reports less occurrences of low back pain, especially on the days when he's adherent to the standing program, changing his position, and performing his core stabilizing and stretching exercises.
那我们根据他的情况，因为他这个坐的时间太久，然后我们第一个就是站立疗法，然后就是他醒着的时间，除去睡觉时间，就是每30分钟呢让他站立一会儿，同时呢改变他的坐姿，还有调整他的工作台，把他的那个抬高他的电脑的高度，这样的话他就不是总是这样子低着头看电脑，然后背部就能够得到缓解。那现在的结果就是说，他的背痛出现的次数减少了。然后尤其是当他坚持我们做的这些站立疗法呀、姿势变换呀，然后伸展运动，明显改善。
Sorry about my dogs.
那是他的狗在叫，他说对不起。
Okay, so then the second case that we saw was a 39-year-old female with multiple sclerosis. She suffered a very bad ankle sprain in March after falling off her porch and was afraid to go to the hospital or her physician or urgent care due to the pandemic and her underlying condition of MS. So she had a lot of pain, swelling over the next 2 to 3 months, and she wasn't able to participate in her regular exercise program because of that. And she presented to us at physical therapy in August, even though the fall occurred in March. And she had continued pain, discomfort, and decreased ankle flexibility.
这是第二个案例，是一个39岁患有多发性硬化症的女性患者。今年3月份的时候，在自家门口的门廊摔倒了，然后造成脚踝扭伤。但是因为是疫情期间，她害怕就医，所以说没有去看医生。那么在接下来的2到3个月内呢，脚踝疼痛、肿胀，没有办法参加平时的运动，包括走路。然后呢，他也没有去做X 光检查，然后没有做影像，然后来排除他是不是骨折了，然后这些他都没有做。那8月底的时候呢，他来到了那个理疗部，然后那个时候呢，脚踝仍然非常疼不舒服，然后脚踝部分的那个灵活性能变差。
So because she never followed up with a healthcare provider, we weren't sure if she had potentially fractured her ankle or torn a tendon or a ligament in the ankle. So we asked her to get that imaging done, as well as perform daily exercises and receive manual therapy and physical therapy to address the range of motion and pain.
那因为他从来没有做过 X 光检查，那我们就劝他，然后去拍了这个脚踝部分的影像检查，去排除他是否骨折。然后呢，还有就是每天进行脚踝部分的动作练习，然后同时也给他一些手法治疗，然后去减少他的这个脚踝的疼痛。
So now it took about 7 months for her to start to feel better which may have delayed her healing process, and she did not come to us earlier.
那现在10月初的时候呢，他的痛感减弱了，但是从他3月份到10月份是7个月的时间，因为他没有去看医生，然后那么他这个脚踝治愈的过程就变得很慢。
All right. Okay. So what else have we been seeing in physical therapy since the pandemic began? We'll go through some things here.
那疫情以来，我们还看到了哪些常见的病呢？那我们现在就来讲一下。
Back, neck, and shoulder pain are very common things that we hear all the time, but especially more so now because a lot of the causes are directly related to what's happening in quarantine.
那我们现在我们经常看到就是背部啊、颈部和肩部疼痛，然后最近看的特别多，是因为 quarantine 了，然后大家都在家里待着，然后缺乏运动。
So some causes: poor positioning and posture while working, prolonged sitting, poor desk setup, falls that have happened, or muscle strains from performing outdoor or home renovation activities, or new exercise programs that have been found online.
那主要的原因是什么？第一个就是那个坐姿不正确，然后在家里坐得很久，还有就是家里面的这个办公桌摆放的这个位置不正确。第4个呢就是说摔倒，第5个就是肌肉扭伤。那是因为什么扭伤呢？因为在家里可能自己做房屋的装修啊，或者说要从网上找到了新的这个锻炼的项目，然后要去参加，然后结果造成肌肉拉伤。
Okay, and then also seeing a lot of lower body injuries, so ankle sprains, resulting from falls or rolling your ankle during an activity or walking. And then plantar fasciitis, which occurs when you're using the wrong shoe wear or doing a lot of exercise, a lot of walking with the same shoes. And since we don't have too much to do these days and walking has become a large form of exercise, we're seeing a lot of this injury.
那还有就是，下肢受伤，第一个就是说脚踝扭伤，因为摔倒啊，或者运动扭伤，或者你现在装修房屋，然后室外活动所造成的。还有一个就是看到比较多的病症，就是足底筋膜炎，就是现在没有其他的运动了，很多人就会走路过量，或者呢运动过量，然后走路的时间太长，或者你穿的鞋子呢不合脚。然后造成的。
Then we're also seeing a lot of arthritic pain and general deconditioning because people aren't moving as much. So motion is lotion for your joints. It's important to be moving and walking, and a lot of that is not happening because of quarantine. So we're seeing prolonged sitting, decreased overall activity levels due to quarantine, and postponing of elective surgeries like knee and hip replacements, which can cause a lot of pain in the joints, and then just decreased strength due to lack of use.
那我们还看到的一个呢，就是关节炎还有关节功能下降。那主要的原因就是因为不能出门，在家里坐得太久了，然后疫情期间，尤其是老人，他的运动量减少，还有就是老年人有的会退出手术，譬如说他应该做膝盖呀或者髋关节手术，因为疫情他就不去做，还有就是这样就会，还有就是那个关节的功能下降，因为用的少。
So some important things that you can look out for are shortness of breath when you're walking, going up and down stairs, weakness in the arms and legs with your typical day-to-day activities, difficulty getting up and down from the floor or any lower surface, as well as difficulty moving around in bed, and any new onset of falls.
那下面几种情况呢，如果你有的话，那就要注意一下。第一就是会气短，你上楼梯下楼梯会觉得气短，然后胳膊腿呢会觉得没有力气，还有就是你站起呀或者坐下会感到很困难，还有就是躺在床上的时候，你要是身体移动一下也会觉得不是那么容易，或者还有就是说新出现的，然后你会跌倒。如果有以下这些症状的话，就要引起注意。
We're also seeing jaw pain as a result of clenching or grinding from increased stress and poor sitting and standing posture. And you may also see associated headaches with this as well.
那还有一种我们常见的就是颞颌关节疾病，然后就是你的这个这里的这个脸上的这个关节，然后原因呢可能就是因为你这个咬合的这个太多了，然后紧张过度咬合，还有那你的坐姿站姿不正确的话，那有时候也会跟这个是有关系的。那有的人呢还可能会有头痛。
And new falls. So people who were not falling before are falling now as a result of not moving around as much and decreasing in strength in the body. So we're seeing this with patients with or without underlying conditions. It can cause or be a result of many of the things that we've already discussed today. So many falls occur within our homes and our yards, which is where we're spending a majority of our time right now.
那摔倒呢，这个发生的原因是有很多种原因造成的。那我们刚才也谈到一些，那无论你之前有无病史，那么都有可能会发生。那很多的这个摔倒发生在自己的家里或者自己家的后院里面。
And with these falls, we're also seeing a delay of getting services for them. So having a patient who falls or has a stroke or has a concussion, but does not follow up with the appropriate medical services because of fear of the pandemic.
那现在还有就是 因为疫情期间，很多人害怕，就害怕去就医，就会推迟就医。那有时候会有中风啊、摔倒啊、脑震荡或者其他紧急状况，这样子就会比较危险。
And then outpatient physical therapy or inpatient rehabilitation are usually quickly prescribed after a fall or a stroke. And a lot of people are not following up with these services due to the fear of the pandemic and preferring to be at home.
那一般来讲呢，就是说你摔倒了或者你有中风，那么很快的医生就会给你治疗。那现在呢，因为疫情，然后很多人呢就会推迟就医。
So now we'll talk about how we can decrease the chances of these things happening to you.
那如何才能够减少这些不幸的情况发生呢？
So I won't go, just in the interest of time, I won't go in through all of these, but for your desk setup, these are some quick tips to have the appropriate posture while sitting at your desk. So top 1 to 2 inches of your monitor at eye level, but not staring straight at the screen. And then having your feet supported is one that we see often. If you're unable to attain this position, you can use a step stool underneath your feet.
OK， 那因为疫情的原因，因为时间的原因，我不可能一个一个都讲。那最主要的就是说，你的眼睛呢要直视在电脑显示器最上方的1到2英寸的地方。那么你的这个眼睛呢，一般来讲是稍微俯视在你的电脑的屏幕上，而不是说直视或者仰视。还有就是你的双脚呢要踩稳在地面上。那如果你的双脚没有办法踩稳的话，那就可以使用一个脚踏垫，然后使你的双脚得到支撑。
And then this, if you're using 2 monitors, I'll note on here to try to set them up in a bit of a V position if you're using both for equal time. And if you're using one monitor primarily, that one would be straight ahead of you and the other one would be slightly off to the side.
那如果你是工作的时候需要同时用2个电脑的话，用的时间差不多的话，那么你可以把它设成一个 V 型，然后那你的键盘呢放在这个2个电脑的中间。那如果呢你经常会用一台电脑，另外一台电脑呢是用的时间不是那么久那么多的话，那你这个常用的这台电脑呢就要面对着你放，然后另外一台呢可以放在你的左边或者右边。
And standing desks are also a big thing right now, which is great, but it's also important to listen to your body. So standing in one position for too long can also cause some discomfort in the joints. So just make sure that you're taking sitting breaks if you're standing most of the day.
那现在经常也会有人把办公桌改成站式的工作台，站着工作，这样是挺好。但是呢，如果你一直保持站立的姿势过久的话，也会造成关节不适。所以说，如果你是站着工作的话，那过一段时间呢，也要让自己坐下，然后休息一段时间。
Okay. So here are some general tips. Changing your position often, walking 10 to 30 minutes per day, and then standing up every 30 minutes if you're primarily sitting for work or school.
这些呢是通常的注意事项，就是要经常变换你的姿势。那每天走路呢10到30分钟进行锻炼，还有就是每30分钟，如果你总是坐着工作的话，那么每30分钟要站起来，然后自己活动一下。
Then also including 2 to 3 days per week of general strengthening of your major muscle groups, so resistance training, and listening to your body, especially when you're starting new exercise or activities. And then with all lifting, twisting, and carrying, being cognizant of your body mechanics, keeping objects close to you, especially if they're heavy.
OK， 还有就是呢，你每个星期2到3天呢，然后要进行一下主要身体肌群，这个要加强一下锻炼，还有要适量锻炼，尤其是当你开始一项新的锻炼项目的时候，要听你的这个身体，然后要感觉身体的适应能力。第3个就是要 然后你这个要抬东西呀，或者扭呀，或者做这些动作的时候，尤其是你要这个抬一个很重的东西的时候，一定要让自己呢保持这个保持身体，比如说要身体要蹲下呀，然后要保持躯干直立，这样的话不容易受伤。
Some other things, being aware of your sitting and standing posture, like we've discussed today, as well as your jaw. So that's something we talked about, trying to avoid clenching and grinding of the teeth. So a general guideline, if you're not eating, your teeth should not be touching. So your posture, you want your tongue up like you're going to say the word no, your lips together, and then your teeth apart slightly.
然后就是要注意你的坐姿和站姿，然后对于那个颚关节呢，就是这个脸部的关节，你要避免用力咬合。如果你不吃东西的话，那你的上下排的牙齿呢不要咬合。那一个正确的姿势呢，就是就好像你在说 no， 这样的话呢，你的舌头呢是贴在你的上颚，那么上下嘴唇是闭合的，上下排的牙齿呢是分离的。而不是咬合在一起。
Okay, and then here are just some tips for at home to avoid falls. So no area rugs, trying to keep everything off the floor that you'll be walking through. Night lights by your bed and in the hallway or bathroom, so that when you're going to the bathroom in the middle of the night, you have some light. And then preventative care is important. Speak with your primary care physician about all the medications you're taking so that we can make sure that none of the medicines that have a combined effect can affect your balance. Having your balance assessment by a physical therapist, as well as getting your eyes checked at least annually.
那这是几点预防摔倒的注意事项，不要放地毯，地上不要放杂物，然后以免摔倒。那在家里的时候呢，使用一些行走的辅助工具，像手杖啊、助行器呀，然后常走的这个家里的通道上不要有电线。那卧室、走廊啊，还有浴室啊，要放一些小夜灯，在晚上的时候不容易让自己摔倒。那浴室里面安装这个抓握的横杆，然后或者呢放一个淋浴椅子在里面。然后楼梯呢一定要装栏杆，还有就是你要去做预防性的检查，然后要告诉你的家庭医生你服用哪些药物，然后呢然后理疗师呢还要进行平衡能力的评估，每年呢还要进行眼睛检查，这些都是预防摔倒的一些有用的注意事项。
And then last but not least, we're here for you at the physical therapy department at Barnabas Ambulatory Care Center. We have our number here if you would like to call to set up an appointment. We also have a rehab blog, which can be a really good resource. There are actually a few recent articles about many of the things we discussed today, so you can head there to check those out.
OK， 这里是我们那个圣巴拿巴医院的门诊部的理疗部的电话，那预约电话，然后如果大家有问题的话，可以打这个电话。那我们还有一个康复的博客，然后大家也可以去看一下。
Okay, thank you very much.
好 ，Thank you, Dr. Kate Bloshi, Thank you。好，谢谢三位专家医生。那现在的话，我们进入到这个问题回答提问的环节了。那我们这个录音呢就会结束了。